day of the Tigray genocide. The demonstrators took to the streets of Washington, D.C. and spent over 24 hours in front of White House to ask the U.S. government to play its part to end the genocide. For more, Saron Tigrai reports.
On a protest organized by the Tigrayan community in Washington, D.C. area, Tigrayans from all over North America marched calling on the international community to stop genocide on Tigray. Marking 500 days of genocide, the protesters first marched to the U.S. State Department, where they called on the American government to take concrete actions and approve the House resolution called H.R. 6600.
Access to Tigray! Allow access to Tigray! Allow access to Tigray! Allow access to Tigray! Humanitarian aid for Tigray! Humanitarian aid for Tigray! Humanitarian aid!
The demonstrators also emphasized that the denial of access to basic necessities, man-made starvation, sexual violence, and endless atrocities being committed on Tigrayans has made Ethiopia a living hell, and justice needs to be served.
But they're not. They're brown babies. They're black babies. They have brown eyes, and suddenly that means that their lives don't matter anymore. What they're going through, the suffering they experience, literally does not matter. People are starving to death. 500 days of no food. You know when you don't eat lunch and you get a headache? Do you guys get that? I'm shaking. Do you understand when you don't eat breakfast and you're a little nauseous? I'm talking about 500 days of that. 500 days of no water. They're eating leaves off of trees. The babies that are being born are deformed. Babies that were conceived by rape are being born deformed because their mothers don't have food. These are actual humans. These are mothers. These are babies. These are lives. They're not figurative people. U.S.
Later that day, the Tigrayan community marched to the White House, where they urged the Biden administration to exert meaningful pressure on the Ethiopian government and its cronies to stop the suffering upon the people of Tigray and called the genocide by its rightful name.
For Tigray! Justice for Tigray! Allow humanitarian aid to Tigray!
Allow humanitarian aid to Tigray!
Allow humanitarian aid to Tigray!
Allow humanitarian aid to Tigray!
Reconnect Tigray!
Reconnect Tigray!
Reconnect Tigray for Tigray!
Humanitarian aid for Tigray!
U.S. airdrop food to Tigray! U.S. airdrop medicine to Tigray!
The demonstrators protested for 24 hours straight, calling on everyone to shed light on the hidden genocide.
His Holiness Abuna Matthias, VI Patriarch of the Ethiopian Orthodox Church, condemned recent atrocities on Tigrayans in Benishangul Gumuz and referred to the violence on Tigrayans as a genocide. This isn't the first time His Holiness has condemned atrocities on Tigrayans. In May of 2021, a close confidant of the Patriarch had managed to smuggle a video message from His Holiness after repeated attempts by Ethiopian officials and church leaders to suppress communication coming from the Patriarch. For more, Winta Kirana reports.
Abuna Matthias, Patriarch of the Ethiopian Orthodox Church, condemned recent atrocities committed on Tigrayan civilians in Benishangul Gumuz. This statement from the Patriarch comes in light of outrage sparked by a video circulating on social media showing militia from the Amhara and Southern nationals and nationalities burning a civilian man alive.
ወደ እሳት መክተት ደሞ ወደ እንደጨት እንደማገዶ እንጨት ወደ እሳት ከነ ህይወቱ አይኑ ያየ ህይወቱ ሳያልፍ እንዳለ ወደ እሳት መክተት ደሞ እንግዲህ ይባስ ተብሎ ደሞ ይሄን አይተናል ደሞ በእውነት መፈጠርን የሚያስጠላ ነው ይሄ መፈጠርን የሚያስጠላ ለምን ተፈጠርን አዎ
The patriarch made these statements in an exclusive interview with Tigray Media House, also discussing the severe impacts of the deliberate and systematic destruction of public facilities and personal wealth that has led to unimaginable suffering for civilian Tigrayans.
ጎተራ የተቀመጠው እህል ደግሞ እንዲበቅልና ሰው እንዳይጠቀምበት ውሃ እየጨመሩ ይሄዳሉ። እንደገና ደግሞ ዱቄትን ከአመድ ጋራ እየደባለቁ ሰው እንዳይጠቀምበት አበላሽተው ይሄዳሉ። ሌላው ደግሞ ከአፈር ጋራ ዱቄቱን ከአፈር ጋራ እየጨመሩ ሰው እንዳይጠቀምበት እያደረጉ ሂደዋል። ያበላሹ ሂደዋል። ከብቶቹ ተነድተዋል፣ ተወስደዋል፣ ታርደዋል። በሬዎች ሁሉ አልቀዋል። የሚችሉትን ያህል አርደው ይበልተዋል። የቀረፉትን ወደ አጓጉዘዋቸዋል። አህዮች ሳይቀሩ ወደ አስመራ ተጉዘዋል። ስፍር ቁጥር የሌላቸው አህዮች፣ ስፍር ቁጥር የሌላቸው በሬዎች፣ ላሞች፣ ፍየሎች፣ በጎች ሁሉ ወደ አስመራ ተጉዘዋል። ክሊኒኮች፣ ሆስፒታሎች፣ ትምህርት ቤቶች፣ መድኃኒት ቤቶች በጠቅላላ እንዲያው ወድመዋል። ፋክተሪዎች ሁሉ ወድመዋል። የቀረ ነገር የለም በትግራይ ውስጥ። ከሁሉ የሚያሳዝነው ቅድም እንደጠቀስኩት በጎ አድራጊዎች የሰጡትን እርዳታ የምግብ፣ የመድኃኒት እና የመሳሰሉት ነገሮች ሁሉ በመንገድ ላይ መኪኖች ተገድግደው እየተንቀጠቀጡ በጭነት ሰው በዚህ በኩል ይሞታል። ለምን? ይሄው ሰው እየረገፈ ይገኛል። በህመም የሚሞቱት፣ በረሃብ የሚሞቱት፣ በመድኃኒት እጦት የሚሞቱት ስፍር ቁጥር የላቸውም።
This is the second time the Patriarch has publicly condemned the genocide on Tigray. In early 2021, a close confidant of the Patriarch was able to smuggle a video out of Ethiopia, where the Patriarch is seen condemning atrocities being committed on Tigrayans.
ይህ አሁን እየተደረገ ያለው የህዝብ እልቂት በተለይ ደግሞ ሲቪሊያን የሆኑ ወገኖቻችን ወደየከተማው፣ ወደየመንደሩ፣ ወደየግለቤቱ ሰው እየሄዱ ወጣቶቹን እየገደሉ ገድለው ደግሞ እንዳይተው እንዲያውም ወደ ገደል እየጣሉ ተገድለው እንኳን ለመቃብር ያልበቁ ለምሳሌ እንደ ማህበረዲው አይነት።
In the same video, the Patriarch expressed frustration that Ethiopian officials and religious leaders were working to deny him a platform to discuss his stand on the crisis and bring light to the human suffering in Tigray.
በትግራይ ክልል እየተካሄደ ያለው አረመኔነት፣ የአረማዊነት ስራ እንዲቆም ብዙ ጊዜ ሞክሬ አልተሳካም። ምክንያቱም ፈቃድ አልተሰጠም። እናገራለሁ፣ ይመልሱታል፣ እናገራለሁ፣ ይመልሱታል። ይሄው እስካሁን ድረስ ምንም አይነት ፈቃድ አልተገኘም።
But this isn't the first instant in history where the Patriarch has been one of the first to openly condemn the brutality of Ethiopian regimes. In 1980, Archbishop Abune Matthias became the first leader of the church to issue a denunciation of the military regime and was forced to live abroad for more than 30 years. He eventually settled in Washington, D.C., where he presided over an Ethiopian Orthodox Tewahedo church made up of exiles that had fled the Ethiopian Revolution and continued to be voice for the many victims of brutal military Derg. In 1992, following the fall of the Derg regime, Abune Matthias returned to Ethiopia. Following the installment of Patriarch Abune Paulos, Abune Matthias was named as Archbishop of North America and was later asked to return to take up his former archdiocese in Jerusalem. But before his return to Holy Land, Abuna Matthias had played a key role in initiating attempts to reach reconciliation between the Holy Synod in Addis Ababa and the exiled synod in the United States, headed by former Patriarch Abuna Merqorios. In February of 2013, Abuna Matthias would be elected as the sixth Patriarch of the Ethiopian Orthodox Church. Long-time advocate for the rights and dignity of people everywhere, Abuna Matthias has once again risen as the voice of the voiceless, calling for the world to stand hand in hand for the people of Tigray.
የዓለም ሕዝብ በይበልጥ እንዲያውቀውና አስቸኳይ እርዳታ እንዲያደርግ አስቸኳይ እርምጃ እንዲወስድ አስቸኳይ የሆነ ተግባር እንዲፈጽም ነው እኔ የምማጸነው። ሌላው በዓለም ያለው ሆነ በሀገር ውስጥ ያለው የትግራይ ሕዝብ መቼም እግዚአብሔር ያበርታህ ነው የምለው። እግዚአብሔር ያበርታህ፣ ኃይሉን ብርታቱን ይስጥህ። መቼም ጊዜ የማያልፍ ነገር የለም፣ ያልፍ ይሆናል።
Health professionals at Maqala Hospital say the siege is having a devastating impact on their mental well-being, as thousands face the risk of death due to lack of medical supplies. Not to mention that many of these health professionals have not had a salary for well over 9 months, meaning they too are facing the brunts of this inhumane siege. For more, Aragawi Gabriel Mikhail has this report.
This is Mekelle Hospital. It is the second largest hospital in Mekelle and provides care for tens of thousands of patients across the state. But like many health facilities across the state, the start of conflict in November 2020 has severely limited the hospital's capacity to provide care for its patients. Systematic destruction and looting of medical equipment, in addition to an almost 9-month long siege on the region that has prevented basic medical supplies from reaching the capital, has meant that millions across the state will have to go without much needed medical supplies. The impact on the health professionals has also been devastating, with many suffering from mental as well as physical trauma. Dr. Emmanuel Gabramedhin is a general practitioner at Mekelle Hospital. He says health professionals are using what little of their own funds they have available to purchase medication from private dealers because they are afraid of losing patients.
Recently, I was treating a patient with diabetes type 1. His sugar level was at 22 when I first took his levels. As soon as I administered insulin, his sugar level declined immediately. It turns out he had not had breakfast that day because he had nothing to eat. We usually give our patients glucose 40% detries when something like this happened. But our hospital was empty, so I have to go to private pharmacy that had few doses left. I just wanted to run out of the hospital that day. I cried a lot that day. We're not even asking for medication for complicated diseases. We're talking about basic medication necessary to treat illness that takes seconds to treat.
Dr. Emmanuel said he's worried about how health professionals may be dealing with the impact of watching patients die due to easily preventable illnesses.
The psychological impact is immeasurable. You can't really eat or sleep. We recently lost a patient aged between 34 to 35 due to lack of medication and oxygen. It couldn't let you eat or sleep well either. I couldn't eat anything at home that day. It is very hurtful to lose a young soul with many hopes.
Sister Hiot Aragawi, a coordinator of the ART Center at Mekelle Hospital, said that the very thing that made me stressed each day is the thought of how to tell my patients about the depletion of medical supplies.
It's the most difficult thing to work in this condition. It's difficult to have to tell your patients that there's no medication. Every time I come to work, I'm worried about having to tell the patients that there's no medication. I know I can't leave my work here. I have a responsibility here, but it's so difficult knowing that there's nothing that can be done for your patients.
According to Dr. Philemon Mesfin, Chief Executive Officer of Mekelle General Hospital, telling patients that there is no medicine is an agonizing experience.
Even if they get to be seen in our hospital, when we tell them some medications for some medications we just refer our patients to some private pharmacies, which I think could be a little bit, the price could be a little bit expensive. So just because he was denied of his or her salary, he or not, she is not getting, they are not getting the medications, even to buy from the outside. Even if the medications are available, sometimes they are not able to buy the medications. You can imagine how the blockage affects every aspect, not only the health, the economical, the social aspect of our people. So you can imagine a farmer, a simple farmer coming from the rural area, needing a simple medication for a simple disease, but the agony of telling him that it's not available, that you cannot help him, it really hurts.
Dr. Hagos Kodofai, head of Tigray's Bureau of Health, says the agony of healthcare workers has been worsened by the siege on the region. That has meant that health workers have not received a salary for over 9 months.
It's not the siege only, by the way. Even during the 8 months war, most of our health work forces were like scattered, displaced within Tigray and out of Tigray. Many health professionals were seeking refuge camp in neighboring Sudan, still serving the displaced people in the camp at Sudan. So they are directly affected. It's not only that. Still, because of the siege, they are not like paid for 8 months, but they are striving day and night to serve the people. They are working day and night. They are committed enough without having food, without having salary, by serving the people, serving the people as a first priority. But currently, we've been reviewing, by the way, with the World Health Office heads and with the hospital heads, when we were trying to collect information from them directly. Many of them, by the way, they were like, especially in rural areas, they were supported by the local community because they don't have food to eat and they don't have also salary. So they were like getting support from the local community as a contribution. The local community contributes like cereals from what they have. But now it's really difficult also for the farmers to provide the contribution because they don't have food to eat for themselves as well.
According to data from the Bureau of Health, over 37 health professionals have been killed since the start of the conflict. Over 37 health professionals have been killed since the start of the conflict, while 78 have been injured, and more than 4,000 health workers have either been internally displaced or are seeking refuge in neighboring Sudan.
The systematic destruction of churches and other historic sites has been a noticeable feature of the ongoing conflict, with Ethiopian and Eritrean forces taking part in the systematic and deliberate destruction of important heritage sites across the state. Dimtsi Weyane spoke with monastics displaced from western Tigray that say Amhara militia killed church leaders and destroyed or looted church property in Waldeba Monastery. Kubrom Waldebran has the details.
The monastery of Waldeba is found in Tsalemti district, western Tigray, a zone where the Allied forces, predominantly Amhara forces, committed ethnic cleansing of majority Tigrayans. During the 8 months long occupation of the entire Tigray by the Ethiopian forces and their allies, monks that resided there were killed. The monastery was demolished and its religious books were looted, according to a report by Dimtsi Weyane. The monks say that they have witnessed horrific acts of killings and destruction inside the monastery.
Many monks were killed. We buried more than 30 of them. We don't know who is alive, who is not. We don't know the whereabouts of many monks. We were not able to identify the corpses as well.
Right there, the first floor of the building used to be a bookstore. It had about 3,000 old Brahma books and 300 artifacts made of gold and silver, including crosses. And the ground level of the building used to be a store for sesame and other grains. We had stored food that we would eat for the whole year. After they had attacked us on March 21st, 2020, we were forced to abandon our residence and they burnt down the houses. All of these buildings were built by our fathers. The Allied forces done this destruction, aiming to stop us from returning back to the monastery. Not only this, but we were also being hunted in Shir and Aksum during the occupation of Tigray by the invading forces.
The monks also say that the invading forces poisoned various food items at the monastery, thinking that they would return back and eat it. However, the poisoned food were eaten by animals from around, which they died consequently.
They took all the sesames, sweet potatoes, linseed, niger, and other grains. After they ate all the food, they put a poison on all that was left, because they thought we would get back from everywhere that we have been hiding and take the poisoned grains to eat, which would have killed us. But monkeys ate it and died. As you can see, their bones are scattered everywhere.
Kahso Abay, administrator of the district of Tsalemti, says that the invading forces have committed unspeakable atrocities on monks and the ancient monastery that used to give religious services and also visited by many tourists.
A wide range of atrocities were committed on the monks of Waldba Monastery. Many of the monks who used to live there for more than 60 years were beaten and forced to abandon their residence by the Ethiopian and Eritrean forces, and also by the so-called Fano Vigilante group from Amhara region. Countless antiquities were also looted and destroyed.
According to a report by the UN, more than 2 million people have been internally displaced, and more than 1.2 of them are from Western Tigray.
Hospitals across the state have depleted medical supplies in the past 9 months, as the Ethiopian government has continued to impose on an all-encompassing siege on the region that has included a blockade on medical supplies and food aid. Our reporters visited Dohan Primary Hospital in Europe, Eastern Tigray, where, according to doctors, 45 patients have died due to lack of medical supplies. For more, Salome Taklai.
The 8 months-long occupation of Tigray by allied Ethiopian and Eritrean forces was characterized by the systematic looting of private and public property, including medical equipment, that was shortly followed by an 8 months-long siege that has blocked the entry of all basic items, such as medical supplies and food aid, devastating a once promising health system. We visited Dohan Primary Hospital in the district of Irob in Eastern Tigray, where doctors say 45 patients have so far lost their lives due to the lack of medical supplies.
There is no medication because of the siege. Since June alone, we've lost 45 patients due to the lack of medication and food aid. This is the number of patients that died in the hospital, but it isn't easy to imagine that many more have died before they could reach a health facility. There is no medication whatsoever, especially medications for chronic illness like hypertension, diabetes, HIV, epilepsy. They are simply non-existent. There is no supply at all, and as a result, we are losing many children.
The health professionals say that allied Ethiopian and Eritrean forces have looted all the medical supplies and equipment in the hospital, including 7 ambulances.
Everything that was here was looted by the enemy. There was nothing here when we arrived, especially in the OR, all surgical materials, anesthesia machines, and everything was out of use. They looted all the mattresses and medications as well. The building is the only thing left. We had 7 ambulances and 1 other vehicle. All of these cars except for 1 ambulance were looted. The 1 ambulance that we are left with is unable to give services because of issues with its battery and sometimes the tire, but mostly the lack of fuel. It has just been parked outside.
The health workers called on the world and anyone willing or able to help to assist the millions in dire need of humanitarian assistance.
Many children under the age of 5 in the district are starving. Many are dying due to lack of medication. All that can help these children should try to do so. We all have to play our part to ensure the health of these children. I call on all concerned bodies to help end this.
According to the World Health Organization, close to 4 million people in Tigray are in dire need of medical attention, as millions more suffer from lack of food aid and other basic supplies.
The closing and the discontinuation of basic services, including banking and telecommunications services, has devastated Tigrayans living in urban areas. Our reporters have observed that many are being forced to the streets to cope with the impacts of the ongoing siege. Miron Imana has the details.
Mrs. Kandishah Gabru is one of the mothers who were exposed to severe starvation due to the war and the siege-induced famine. She explains, before the invasion, she used to engage in different jobs and take care of her family. However, she now has started begging for food with her children on the streets due to the siege, which made it impossible to generate any income for her.
We were living comfortably at the time. I used to do hairdressing and generate income for my family. But now, there is no paying job. There is nothing I can do but beg for food on the streets because we had nothing to eat.
Child Umay Berha and Dejan Barahi would have attended their school and advanced in education, but that has become simply a luxury for them. The man-made famine has forced them to beg as they had nothing to eat.
My name is Amay Berha. I came from Gijat. I came here to beg because there was no food back at home.
I came from Gijat. I'm begging here because we have nothing to eat.
The children explain that they're not getting help or donation as the other Tigrayans themselves are financially troubled at the moment and are in grave danger.
Only few people give us food or money. Most people tell us that they don't have anything for themselves too.
The people we beg for are also suffering. They cannot help us out.
Humanitarian workers such as Mr. Barakat Mukkonen and Ms. Leah Haila say that the number of people who are being forced to beg on the streets is escalating due to the siege imposed on Tigray.
The number of people being starved is alarmingly increasing from time to time. At first, people were helping each other out, but as the siege intensified, the people who used to offer help are now seeking help for themselves. Everyone is suffering now.
We're looking at escalating magnitude of starvation. There are starving mothers, children, and elderly. Even the ones who were at better financial states are now exposed to severe starvation. The humanitarian workers also called upon aid organizations and the international community to reach out and help those children in need.
Everyone should donate and help out those children. Even a bread can save the lives of these children. We can help them get back to their schools.
Everyone should help those children in need and get them through this difficult time. The children and mothers call for help and urge all aid organizations and international community with their weakened voices.
We are suffering. I urge you to help us out.
I urge people and concerned bodies to help us out, to get us back to school. We are starving.
And that's it for this edition. Thanks for watching. Bye for now.